Today I am doing some lip filler for a patient's beautiful lips. And lip filler is made of hyaluronic acid, which is what we have in our skin to begin with. And we're not putting anything unnatural into her lips, but we're just plumping them a little bit because sometimes we get, a little bit dry or feel a little bit wrinkly, and the lips are so cute when they're nice and plump. I mean, think about all that lip plumper that's out there on the market, just that you can buy at like Victoria's Secret or wherever. People love plump lips. So I have some numbing cream on her already, and we're just going to outline her lips. The little filler, 1, 2, 3, hi, hi, hi. And we're just gonna go slow and steady. You can always combine this with lip flip with Botox if you wanted. And that helps to lift the lips by paralyzing the muscle that's pulling down, so the Botox can help pull it up. But the filler is going to give you volume. You ready again? 1, 2, 3. Hi, hi, hi. You're doing great. Love it so much. I feel excellent. Awesome. You're doing great. Okay, I'm gonna go to the other side, just do a little bit up here. And generally lip filler can last you for a year. It really depends on what you do with your mouth. Like if you're a big talker, 1, 2, 3, or you use a lot of straws or you pucker a lot for whatever reason, you're gonna go through it a little faster. If you're a smoker, you're gonna go through it a lot faster. So I try not to really do lip filler in smokers that much, or I tell them to try to take like a week off of smoking, which is really hard to do. But if you keep moving it, you're going to keep working it, and we don't want to work that filler. We want it to last for the whole year. But you can always come back and get more. Which I love. 1, 2, 3. Here we go. You got this. You're doing so great. There are different techniques to do lip filler. This is kind of a standard technique to just outline the vermilion border. I like this because it kind of lifts and it plumps and all the things. And we don't change the shape of your lips at all by doing it this way. If she had really small lips, we would use a different type of filler. There are different types of fillers. Some of them can give a little bit more structure. Some of them can give a little bit more lift. So it really depends on your own lip anatomy as to which filler we choose. You don't have to worry about that. You just need to make sure you go to a provider that knows their stuff. So I don't know if you know this, but we're in the top 1% in the country with how much Botox and filler that we do. So we know our stuff and always are doing training. Actually have another training coming up next week. So at least once or twice a month we're doing training on something. 1, 2, 3, ooh la la. So that's always important. Here we go. And again, there's different types of filler. There's so many different types. Certain ones are for the lips, certain ones are for the cheeks, certain ones are for the nasolabial folds. Again, not for you to try to figure out at home, because you wouldn't want to be putting a cheek filler in your lips because that would be too hard, and you wouldn't put a lip filler in your cheeks because it would be too soft. So again, leave it up to your provider. You just tell him or her what your goals are, and then they can help decide which filler is the right one for you. So let's see, look at me, turn to me. Super cute. 1, 2, 3. Now hopefully this is a little bit numb now that there's some lidocaine in there. So that is a typical lip injection. You can see our patient looked really comfortable doing it. And she will have some swelling tomorrow and the next day, which she will love. She will feel dry for the next probably week or so. So I always encourage people get some Epion's anti-aging lip repair, or just get some kind of moisturizer for your lip. And when you put it on, you want to tap it on. You don't want to go and mash your lips together. because lip filler is like water on a dry sponge. So it's going to sit on top for a minute and then it's going to integrate in. If you push on it, you're going to push it right off that dry sponge. So no pushing on the filler. Try to avoid small bottle tops, straws, things like that for the next week. Anything you're puckering heavy for, no flute playing, you know, those types of things for the next week. And then we have up to 2 full weeks to mold it. So I always have my patients come back within the 2-week mark. So if I need to move it, I can. Really risks are, you know, bruising, but she's not going to bruise. She hasn't even bled, which is wonderful. I love that. And I mean, that's really the main, I don't know, downside of doing lip filler. The other huge downside is the addiction that comes along with having super cute lips. So I'm here for you. I'm here to feed your addiction. If you want to find out if lip filler is right for you or about any of our other over 55 procedures, you can find us online at RejuvenationMDMedspa.com.